Good afternoon, first of all, to both of you. No, we don't need to do this. Good afternoon to both of you. Thank you very much. I basically, as you know, that I wanted to know that you have taken the initiative of going and this amazing COVID 19 in 2020 has affected many of us emotionally, physically, mentally. So, what made you think that you want to take such a step? Mamadou, how did you come out with this idea that, first of all, give me a brief about COVID. What sort of fever you had in 2020?
As you know, as you said in the beginning, the COVID has affected the world, entire world, and the whole media and everywhere. We have that one, and we have gone through lockdown, not only in KSA, everywhere in the world. We can say around you can say 80% of humanity was in lockdown. So it's a something which it's known by everybody. We cannot ignore it, you know. So seeing the impact of that one. So and I was following also the news about the vaccine. So once I heard that a vaccine has been approved in USA, and then it was spread to some few countries, and they started giving that vaccine. So I was waiting once there is a chance or a possibility in Saudi Arabia to
Okay.
be one of the people who will apply
Okay.
for that vaccine in order as a preventive measure, you know.
Doctor, what came into your being a medical doctor? Of course, you have a lot more in-depth understanding than what we probably have. So, how was it for doctors? In the beginning, we felt this is just nothing. When it spread it out in the European countries and back in October, late December, it wasn't really. It was just spreading. We were not thinking that it will come and it will be so horrible that it will take so many lives of the people. From a medical perspective, before we talk about anything else, how did you feel about this fear? Was this something known, being a medical doctor in the early stages, that this something might be coming?
Uh, First of all, early at 2020, the pandemic, when it started in many countries, we thought that it would not come to our area. But very fast, it became one part of our life in all countries. And all areas affected, all countries. It's very good measures done by Kingdom Saudi Arabia as prophylactic measures, but the suffer of lockdown at the level of individual levels and the family level and the economy level in other countries also. Maybe we didn't notice that too much here, but we felt the lockdown effect. Psychological problems happen due to lockdown and the fear of complication after being infected and the spread of disease. One of the major complication was admission and treating in intensive care units, and the rate of death, which reached to almost 2%. This lead countries to seek for something as prophylaxis. This is very important in any disease, especially serious diseases. And the success of having COVID-19 vaccine was wonderful. And medical personnel, we all read about the advantage, the phases, the rumors about the vaccine, and we excluded all that by searching a lot to see this is a rumor or scientific research. and after that all, majority of healthcare and other people, they are welcoming to receive the vaccine, which occurred now in Saudi Arabia.
It's amazing actually because when you come to think about this, are people trying to make money by having this medicine available in the market? Is it really that effective that it is going to take, taking care of such a dangerous disease which has taken millions of people's life? Is it really the core that is what we are going to do? As we all understand that from access insurance perspective, I think what I am aware that you the only two people at the moment who have taken the vaccine, and obviously, so how did you feel when you were going to the first day to get the vaccine done? I mean, it must be you don't have any thoughts in your mind because I've been hearing that there's going to be some chip inside your body and people are going to be monitored
Follow you.
and
Yeah.
all these kind of things that are all the rumors that are there in the market. Uh, when you decided that you want to go and do it, and when you actually happened, what was your experience? How was your feeling when you actually got it injected? It's not a
Act-
normal injection for sure.
Actually, before going to get the vaccination, I was following the scientific community. You know,
Okay.
many experts on different media and the different channels. I was following that for a long period.
Okay.
So I got the idea and of many of the experts from scientific community.
Okay.
So when I decided to apply first on Sehati application
Okay.
of Ministry of Health to request okay, I did that one. I was no doubt in my mind that the vaccine is something benefic. It will not hurt me.
Okay.
So this was my understanding, and
So mentally you were prepared.
yeah, mentally I was prepared, So before going, I was no doubt. I decided I will go to take it. I will go to take it.
Okay.
So when I went exactly the day of appointment,
Yes.
I was impressed by the level of organization in the area of the vaccine center.
Okay.
It was well organized. They will receive you from the road, from the gate
Okay.
of the center. So you have people from Ministry of Health who will welcome you. They will welcome you. They will receive you. Okay, they will accompany you from the gate up to the room of vaccination.
Okay.
Okay, you are received there by doctors. They will explain to you each and every procedure of that vaccine,
Okay.
and they will let you know that no harm of that from
Okay.
this vaccine. You
Okay.
know, so I was comfortable. Really, what I saw there, it was amazing in terms of organization and the professionalism. What I got from the medical team in the vaccine area.
Yes, this is very good. I mean, that's
Yes,
something give you the confidence that there's been a lot of efforts being put in to
exactly.
make sure that the process and the satisfaction of the customer who's
Personal
actually coming in,
satisfaction. Yes.
it's not easy,
Yeah.
to just to think about it. When you got the injection done,
Yes.
did you feel anything different, or are you just feeling just normal? Is it?
No, it's a normal like any injection, And after that, this is my second day now because I took it yesterday morning.
Okay.
So today is my second day. I don't have any issue. It's a normal one, as any normal injection.
Okay.
Yeah. So it's
So you're
okay.
feeling comfortable, doctor. I will ask you. Obviously, the comfort zone is there, and whatever. Uh, we don't know as we speak today what will be or are there going to be or there are any side effects to this vaccine. Do you think that there is anything known? Because it's too early to put such thing. But for sure, during the testing or during the process of that, do you think that there is any side effects?
Okay, we can say that We have the short-term side effect, which was done during the phase one, two, three before injection. It was among 40,000 people, volunteers for vaccine to study as a research. And at short-term side effects, it's almost very, very mild, like pain in the arm or some one-day fever, which actually I didn't suffer anything. I received 2 days back with my wife also. Only pain in the arm for my wife. For me, I didn't feel even the pain. For long-term side effect, it will be studied. The study will come out maybe after 3, 4 years.
Right.
But to have to equal the benefit and risk of vaccine, you have no side effect at short term, and you have research about this new vaccine, about how it works and what is the expected side effect. And now nobody can wait 3 or 4 years.
Yes.
People will not die awaiting for the vaccine. This first. Second, we have since maybe 2 centuries or more, we have old vaccines. We always have people against vaccine. They are anti-vaccine
Yes.
people. And we have people of conspiracy theories, and they are telling about they want to sell, they want to gain money. But I'm wondering how they will gain money, and they give the same vaccine to their healthcare people who are taking care of them.
Correct.
They started with that. I'm against these theories and against the anti-vaccine, just as people are talking, and I'm sure that many of them received the vaccines.
Yes, I think there were talks about it when we first started to, as soon as this situation was slightly changed and how we're seeing things are getting in the right direction, they're moving. There were talks about there is going to be a charge. We will be charged for this kind of vaccine in third world countries as well. They said obviously they cannot afford it. But then eventually the whole thing started to change. It's now free of charge, especially in Saudi Arabia. We are not being asked to pay anything, and we've been welcomed that people should go and have their thing done. Doctor and Mamadou, is there a phase for this? For example, you've taken one dose and there is going to be another one, or that's it, you've just taken one dose and you are good enough for the chances of COVID-19 happening to, God forbid, to any of you after taking the vaccine is dropped dramatically, I believe, maybe 60, 70, 80%. The risk will be less than what we think by taking this vaccine.
Um,
Yes,
Um,
go ahead.
um, First, after the first vaccine, the I mean the immunity for me or anyone receives the vaccine will be only 50%, and it should be another shot of vaccine. It will be after 3 weeks. Actually, we received already the date of second shot
Oh,
for me and for Mamadou.
Exactly.
okay.
Yes, they are, as Mamadou said, they are very well organized. Everything is very simple, easy. They did everything very right. Okay, and they give us appointment of second vaccine. I heard about people are now increasing, requesting and demanding, especially after seeing the authorities and the people in charge here,
Yes.
like Crown Prince and the Minister of
Minister
Health.
of Health, yes.
They received all the vaccine. The people encouraged more. They are motivating people. They are not hiding any data, any information. That's it.
No, it's very good. I think at the end of the day, this is something that we are moving forward to. There are so many things that has happened, and we hope this 2021 does not give us any reflection of 2020. It's been a very tough year for all of us, emotionally, mentally, physically, I've been talking to people and they've said that we've never seen a life that we've been locked down, even during the World Wars.
Well,
You know, we're not locked down the way that
Yeah.
we were locked down in this couple of months.
exactly.
I remember that we were in lockdown for almost 2 months.
Yes.
The whole Ramadan was spent inside the houses, so it is quite difficult phase. But hopefully, we are moving in the right direction by having this vaccine. And you think that there's going to be twice two doses of this? The total
Yes.
doses are two, and then hopefully things will get better. Um, for our people who will be viewing this video, um, what do you think is the process? How can I get myself vaccine, for example, if I need to? What would be my process to do
And
that?
the process is very easy. There is an application Sehati
Okay,
on Ministry of Health yani, website.
okay.
Just we need to go. We need
You download that.
download the application and register.
Okay.
Yeah.
And for within that application, they have this for COVID vaccine. There's an option for
Exactly.
vaccine.
Option is there for COVID vaccine.
And is there in basically we are in Riyadh at the
Yes.
moment. I know this vaccine is available across the kingdom.
The kingdom. Yes, that's
Are
correct.
there any specific centers here that have that facility, or is it available quite easily in number of centers, or there are limited centers in Riyadh, for example?
To my knowledge, I think there are many centers, doctor.
Yeah. They started with a very big one at Riyadh Expo. I think it's accommodate hundreds of people to receive vaccines, and they have centers also in Jeddah and in Khobar and Dammam. For my knowledge, also they started with this big center or to make the vaccine campaign. It's in Riyadh Expo, which we visited already.
Okay, so you're happy with everything that has gone through from the kingdom's perspective as well, from Saudi Arabia. But this is where we are, and we have seen that the process has been very good, the response has been very good. What is your message to the people who might be seeing this? Do you encourage them to take this vaccine and benefit from this, and we hope that it will help us in the future as well? And what do you think about your colleagues in AXA who are also maybe feared at the moment because we do have this thing, well, I don't need it, I'm fine, it will not happen. A lot of people were thinking COVID would not come to me, but I think. So, what is your message to those people? Simple, precise message that you want to give.
Yeah. My message is for everyone, please look around you. You will find your relative, your friend, many people affected, and many of them they have complication, and we lost some beloved ones for many of us. This is quite enough to encourage us to go for vaccine without hesitation. If you read about or hear about rumors, please check well behind it. Look, don't just hear something in media about the don't take vaccine. It's something. Read, ask people, ask healthcare people. I'm encouraging everybody to receive. If 70% of population receive the vaccine, then it will end after 70% of people.
I think this is one of the reasons why I wanted to discuss this with you, because you are the first people in AXA who are actually doing this, and hopefully when you take your second vaccine, the second dose, we will also have another session just to quickly to understand. This message will help millions of people out there who are basically hesitant. I hear about it, talking about myself. I hear about somebody has taken it, but I'm not sure because I don't see it. Here we will have the visibility because obviously you're coming to the office. We will know, we will get some information from you.
Exactly.
You know, please do share something, whatever you feel about it, what it is good, how it has made yourself difference. This has made a difference because there are millions of people, and I'm sure this video will go to a lot of people because of my connections kind of thing. So a lot of people will benefit, and the like you said, the rumors that people have in their mind will help them, because today we are discussing this with the people who have actually taken it. You know. So thank you very much, Dr. Sami. Thank you very much, Manavan,
Thank you.
for this exclusive kind of discussion. Hopefully, we will take it forward, and I'm sure that AXA will also encourage their staff as well eventually to take this forward. Thank you.
Thank you.
Thank you very much. Thank you.